Good afternoon. Thank you for invitation to this meeting. And let me maybe in these few minutes I have to focus on what COVID show us as across EU and different member states. I think for sure this is very clear the difficult and complex lessons we are getting, in the health systems. Disruption, it's very huge, but also I think we are learning a lot during this crisis. The first important message we got, if we can give the teacher name to this virus, that the very critical factor is there are workforces, so we have to be well prepared concerning the workforces. We have to be the workforces, doctors, nurses, social workers. They have to be trained and prepared for such challenges as we are facing. They should be organized different way. We have seen many member states situation that it was very difficult to develop the shifts to avoid the cross-contamination, for example, because of number of individuals available in the hospital settings, or because of lack of training. For example, it was very difficult to train doctors on site. They don't work in the normally in ICU settings to become ICU doctors. Same for nurses. They were not prepared even to use the equipment that was even provided on time, but still was a question how to use, what are the quality control measures and so on. So this also was one of the trigger of our grant we offered to European Association of Intensive Care Medicine to help with the training program in such cases. So basically we can enlarge the group of doctors, nurses working in the field effectively if we train them better. But the second, of course, challenge was the turn to the digital. In many countries there was a lot of work going on concerning electronic prescriptions or preparation for the teleconsultation. But often it's happened, that the country was and healthcare providers and sometimes patients were confronted with completely new way of working. And again, the technology helped, but the culture change. First, how to provide those services, what are the effective way of providing services, but also acceptance by the patients is a big challenge. But for sure, the digitalization was triggered in many countries. The other difficulties was we are confronting with a new virus, new threat, and we have to develop quickly the treatments and vaccines. And again, here we need more, better way of working together. I mean, as we really try hard, across Europe to help with evidence gathering, but we have seen in many cases that there were all kinds of treatment options tried. It was very difficult to gather evidence. The industry also was confronted with the difficulties to start clinical trials. So we also try to push this and help with some kind of flexibility in the system to continue work. And I will also say a few words about the side effect of this focus on the COVID patients, because we also have seen in a number of countries, a number of health systems, difficulties for access to other type of treatments like oncology, diabetes, or cardiology for patients. There were a number of planned surgeries also postponed due to the big number of COVID patients. So we have seen, the claims from a number of patients groups, that they should be organized differently. But at the same time, we have seen lack of communication or lack of trust of non-COVID patients in the system. So not only the system or hospitals postponed surgery, but also patients were afraid to go to hospitals when we have seen COVID patients. So in final comments, I would like to say that the big lessons for Europe is that we really have to be better connected. We have to work together. We should think about training, which is also flexible, the way allowing to work in the difficult situation like this. And lastly, we need more data and facts to help our decision-making process be better and quicker. Maybe the final word, we should also better communicate to our citizens and public.